Hello, my name is Jose, and the topic for my presentation will be over pneumonia. So, what is pneumonia? Pneumonia is an infection in your lungs caused by bacteria, viruses, or fungi. This infection causes your lung tissue to swell and become inflamed and cause fluid or pus in your lungs. Pneumonia can affect one or both lungs. Pneumonia in both of your lungs is called bilateral or double pneumonia. Some symptoms include chest pain, coughing, fever, shortness of breath, rapid shallow breathing, and fatigue. So, what causes pneumonia? Pneumonia can be caused by multiple organisms, but mainly germs, viruses, and bacteria that enter the lungs and cause infection. The immune system then attacks the germs, which can cause inflammation of the air sacs. This inflammation can cause the air sacs to fill with fluid and pus, which can lead to pneumonia symptoms. Streptococcus pneumonia is one of the most common bacterial pneumonia that is found in children. Influenza virus is the most common cause of viral pneumonia in adults. Classifications of pneumonia. The following classifications of pneumonia are the most commonly seen in the X-ray field, which is alveolar pneumonia, bronchopneumonia, interstitial pneumonia, and aspiration pneumonia. Alveolar pneumonia is also known as airspace pneumonia. Alveolar pneumonia is an infection that occurs when the air sacs or alveoli in the lungs become inflamed and fill with fluid or pus. This can make it difficult for oxygen that you breathe to reach your bloodstream. Alveolar pneumonia can be spotted on X-rays by white spots in the lungs called infiltrates. That gives a white hazy appearance in the bronchial tree region. Interstitial pneumonia is mostly caused by viral and mycoplasma infections. In this type of pneumonia, the inflammatory process mainly involves the lining and the walls of the alveoli and the interstitial structures of the lung. These interstitial structures of infection produce a linear or reticular-like pattern on the radiographic image. Aspiration pneumonia can be caused by aspiration of esophageal or gastric contents into the lungs. Things like food, liquid, saliva, vomit, or small foreign objects are commonly inhaled instead of swallowed. Aspiration of esophageal material can occur in patients with esophageal obstruction, such as tumors, strictures, achalasia, Zinker's diverticulum, or neuromuscular swallowing disturbances. Both types of aspiration can cause multiple alveolar densities to be seen widely on both lungs. Bronchopneumonia is inflammation that starts in the bronchi and then spreads to the adjacent alveoli. Since alveolar spread of the infection in the peripheral air spaces is minimal, inflammation usually produces a small patch of consolidation. Bronchial inflammation usually causes air obstruction, which then leads to atelectasis with loss of lung volume. The small patches of consolidation may be seen radiographically as opacification that are scattered throughout your lungs. The primary modality. The primary modality that pneumonia is seen on first is X-ray. On this image, the patient that I took this X-ray on, you could clearly see the right lower claustrophrenic angle has some haziness appearance to it. Once the image was sent, I asked the tech to check the report and it came back positive for pneumonia on that right side. The second image was the X-ray that was taken on the next day. You can still see some haziness appearance on that right side, but the physician said that the patient could be cleared. Additional modalities. This was the CT scan taken of this patient. You can clearly see some haziness in the back region of the lung field and also near the front towards the rib cage. Treatment and prognosis. Pneumonia is treated differently depending on the type of pneumonia you have. Bacterial pneumonia is treated with antibiotics, while viral pneumonia is usually treated with rest and hydration. Other treatments may include pain medicine for fever and muscle pain, oxygen therapy to help you breathe easier, cough medicine if your cough is severe, and antifungal medicine for fungal pneumonia. And these are my references, and that is the conclusion of my presentation, and I hope you guys learned a little bit about pneumonia and the different types of pneumonia. Thank you.